Yes.
Okay, thank you. All right, so I will continue. So I'm going to talk for just a few minutes about the health impacts of gas-fired power plants. And so I work with a team of scientists and clinicians at the Icahn School of Medicine at Mount Sinai, and I am a part of the Institute for Exposomics research. And so I will explain to you what that is really quickly. So exposomics is the study of the totality of everything that we're exposed to across our lifespan. So we don't think about exposure to one thing at a time, one air pollutant at a time, but we're thinking about the whole environment that a person lives in and develops in, because we know that all these factors interact. And so that kind of comes into play in what I'm going to talk about related to the power plant. I also work with the Pediatric Environmental Health Specialty Unit, and we're part of a national network of specially trained environmental pediatricians and scientists, and we serve New York, New Jersey, Puerto Rico, and the Virgin Islands. And so we do consultations with patients, health providers, and communities on creating safer environments. So this is probably not a huge surprise to all of you that chronic diseases are on the rise, particularly over the last 20 years or so. And so this has happened at such a rapid rate that we know that there are environmental factors that are underlying all of these. These are things like neurodegenerative disorders, asthma, which we already talked about, cardiovascular disease, even infertility. And so we know now that environment plays a role in essentially all of these. And we also know that air pollution, which is really a mixture of gases and particulates, are responsible for a number of those increasing health risks. So studies have shown that living near a gas-fired power plant is associated with higher rates of asthma hospitalizations, respiratory infections, and COPD. And it's not just respiratory outcomes that are impacted by exposure to air pollutants. So essentially, every system of the body has been shown to be impacted by air pollution exposures, which is not entirely surprising given that mixture of chemicals that you're actually exposed to when you breathe in air pollutants. So cardiovascular disease, stroke, increased autism risk, lower life expectancy, and also increased COVID-19 severity. So we know many of the regions that would be impacted by this particular power plant were very hard hit by COVID-19. And we know that areas that experience higher air pollutants also had more mortality and more severe outcomes related to COVID-19. So the people who are most affected, obviously, are people who spend more time outdoors or who have pre-existing conditions like asthma or COPD, but also pregnant women, young children, and frontline communities, communities of color and low-income communities. And I'm going to focus a little bit on that as well. So of course, in the work that I do, working in environmental pediatrics, we think a lot about the special vulnerabilities of children. And children are highly vulnerable to exposure to air pollutants like those that we know are emitted from a gas-fired power plant. This is partly because they breathe at a faster rate. They take in a higher volume of air, and so they're exposed to more pollutants than an adult is. They're also more likely to roll on the ground, put their hands in their mouths, put other objects in their mouths. And a lot of the pollutants that come out of a gas-fired power plant actually settle in dust and soil and can get inside homes. So that's another route of exposure. And then children are also more susceptible to the impacts of climate change that are exacerbated by burning of fossil fuels. So children have a harder time regulating their body temperature and responding to extreme temperature changes. Of course, it's not only adults that are highly susceptible to air pollutants and other exposures. So we're very concerned about exposures that occur during pregnancy. We know that children who are born to mothers who are exposed to air pollutants during pregnancy are at greater risk of developing asthma. And the elderly and people with pre-existing conditions are also more vulnerable to air pollutant associated diseases. So thinking about children's health, we actually know that air pollution contributes to 1 in 10 deaths of children under 5 years of age. So that's a really high number. I already mentioned things like autism and behavioral problems have been associated with air pollutants. And it's estimated that air pollution contributes to 600,000 deaths in children under 15. And so I just shown here what happens with 1 portion of the air pollutants that are emitted by gas-fired power plants, particulate matter. We're still learning about how particulate matter impacts health. But you can see here, we've tried to depict that the very small particulates, PM 2.5, but also ultrafine particulates, which are even smaller than that, penetrate very deeply into the lungs. And that's where a lot of gas exchange happens and where those particulates can enter the bloodstream. And we think that's why they're impacting so many different health outcomes. And so it's not just at what stage of your life you're exposed to these chemicals and air pollutants. It's also your race and ethnicity that can impact your health outcomes. And so we know that environmental racism has led to health inequities in this country. We already talked about Asthma Alley, but you can see here this graph depicting that Hispanic and Black children are experiencing much higher rates of asthma than white children are. And this actually persists if you take income out of the equation. And this is likely because hazardous waste facilities, fuel-fired power plants, and other point sources of pollution, traffic sources as well, are more likely to be sited near communities of color. Black and Hispanic individuals have been shown to have higher body burdens of many chemicals, and multiple exposures like exposure to stress, violence, air pollutants, and other chemicals lead to worse outcomes. So Matt already showed this map, and I put this up again to just emphasize that the EPA finds that there are a higher percentage of minority and low-income communities living within 3 miles of a power plant. And again, you can see at the center of this bullseye where the proposed power plant in Kearney would be. And you are likely all pretty familiar with the communities surrounding this area to know that many of them are environmental justice communities that would be highly impacted. And of course, it's not only communities within a 3-mile radius that can be impacted by a power plant. We know even that air pollutants from, for example, wildfires on the West Coast can actually reach the East Coast. So we know that this would have even further reaching impacts on health. And so just to zero in a little bit on Jersey City as an environmental justice community, Jersey City is considered to be overburdened under the New Jersey environmental justice law based on the high percentage of low-income, minority, and non-native English-speaking residents who live in this community. And you can see where the power plant would be, again, marked with an X. Oops. And so looking at some data that the US EPA maintains in a database, and you can find the link at the bottom of the screen here, the EPA Environmental Justice Screener allows you to examine different census tracts to see where they fall in terms of both environmental and health and sociodemographic factors. And I just pulled out a few of them to show. Again, here is the plant marked with the X, and you can see everywhere that you see that's yellow or orange or red, all of these communities have are in the greater than the 80th percentile for air toxics, respiratory hazards, for particulate matter 2.5, have high percentage of people of color and a high percentage of low income individuals. So these are all greater than the 80th percentile when you compare them, when you compare these communities to the US as a whole. So these are very highly impacted communities already that really can't sustain another source of air pollutants. And so just to share, touching back on the exposomics idea, this idea of how all of the factors in our environment impact health, and zeroing in a little bit on why certain communities might be more impacted by air pollutants than others. We have studies from our center at Mount Sinai showing that women who are exposed to stress or trauma or violence during their pregnancy, together with air pollution, actually have a higher risk of having a child who will be at risk of asthma later in their life. So women who reported experiencing low stress but were also exposed to particulate matter 2.5, did not have children who were at risk of developing asthma. But women who were exposed to both stress and air pollutants during their pregnancy had children who were then at risk of developing asthma. So just showing that we have to think about all of the characteristics of these communities that we're going to overburden further by the construction of a power plant. And so lastly, I'll just say, thinking more broadly about indirect health effects of a power plant like this is that that a gas-fired power plant is a major contributor to climate change. And there are a myriad of health effects associated with climate change that also affect our most vulnerable populations, including children, including communities of color. New Jersey has already experienced much of this. For example, post Hurricane Sandy, so extreme heat, more severe allergy season, greater insect-borne disease, extreme weather, which causes stress, and so on and so forth. And so I'm going to leave it off here just to say that we have a number of resources, and you can take a picture of these QR codes. We provide guidance for families on how to avoid bad air quality days, how to reduce your own contribution to air pollution and climate change, and a number of other resources related to environmental exposures. And we're also on social media through our institute and through our clinical groups. And that's it. So I thank you for your time.